All right. Good afternoon, everyone, and welcome to today's webinar entitled Best Practices in Data Management and Security. My name is Dr. Dana Hunter, and I'm an investigator with Arizona State University's Office of Community Health, Engagement, and Resiliency Center, or OCHR as we call it, under the leadership of Dr. Mary Ellen Brown. We are a 2110 CCR recipient along with Washington State University Partnership. Before we begin, please know that today's webinar is being recorded. We would also like for you to know that we have interpretation throughout the duration of the webinar. Today, we are pleased to have with us two interpreters, Veronica Geller and Diana Donati. I'd like to share instructions on how to engage in the English or Spanish channel. On the bottom menu in the Zoom window, there's a globe icon that says interpretation. Click on that icon and select your preferred language. Also, a friendly reminder for all of our speakers today, we ask that you speak clearly and slowly, giving them time to interpret. Next slide, please. Now we will go ahead and get started. We want to thank all of you for taking time to be with us today. Today's webinar is part of the Community Health Workers for COVID Response and Resilient Communities, or in short, the CCR program. CCR is a CDC initiative launched in 2021 to support the training and deployment of community health workers, or CHWs, to strengthen community resilience and address health disparities to fight COVID-19. If anyone would like more information about the CCR program, you can click on the link provided in the chat box to find more information. And now I have the esteemed honor of introducing today's speakers. Our first speaker is Dr. Tomas Nuno. Tomas is an assistant research professor in the University of Arizona Mel and Enid Zuckerman College of Public Health, Department of Epidemiology and Biostatistics. Dr. Nuno is a co-investigator on the Centers for Disease Control and Prevention funded projects and National Institutes of Health, NIH funded projects. He serves as lead for engagement of the All of Us research program in Arizona. Next slide, please. After Tomas, we will hear from one of OCHR's very own, Zoe Bakam. Zoe is an MSW PhD student at the ASU School of Social Work and research analyst at ASU OCHR. She has a master's in public health from the University of Arizona. Her previous scholarship has focused on infectious disease and violence epidemiology. Her research interests include utilizing systems, thinking for risk and prevention of violence and trauma in communities. After Zoe, we will hear from Mrs. Luisa O'Mara. Luisa is a senior research coordinator at the Center for Equity Research at Northern Arizona University, where her work focuses on community health workers and community health representatives, or CHRs, workforce sustainability and interventions, social determinants of health, and community-based participatory research and evaluation. And last but certainly not least, we will have a presentation by Mrs. Shreya Raju. Shreya is a recent graduate from Northern Arizona University with a master's degree in computer science. With a strong background in data analytics and a passion for making a positive impact, Shreya has dedicated herself to leveraging data to improve healthcare outcomes. We look forward to learning from each of our presenters and want to thank them in advance for taking time to share their expertise. At this time, I will turn it over to Liz, who will review our agenda and read ASU's land acknowledgement statement. Liz?
Thank you, Dana. So today we will discuss the following topics: data governance and privacy, data sharing agreements, some options for data management systems, and some data management strategies, including lessons learned from our partners, CHRs with us at NAU Center for Health Equity Research. And please share your questions and, if applicable, who you wish to answer your question in the chat or the Q&A. We'll have about 15 minutes at the end to address any questions you have. So Arizona State University's Office of Community Health, Engagement, and Resiliency acknowledges the 22 Native nations that have inhabited this land for centuries. ASU's 4 campuses are located in the Salt River Valley on ancestral territories of Indigenous peoples, including the Akmel Odom and Peeposh Indian communities, whose care and keeping of these lands allows us to be here today. We have a handout for you today, and I will share a link to this document in the chat. Please stick around for information about upcoming webinars at the end of today's presentation. And at that time, I'll also share links to register for those webinars in the chat. Lastly, please keep in mind that AMP is where you will find information about the CCR project and where you can make any TA requests for assistance with your project's evaluation, including follow-up on any of the topics that we covered today. So here's our code of care for today's presentation. I will highlight a few important things to remember. You are welcome to introduce yourself in the chat if you haven't already and share what organization you're working with. Please use the Q&A throughout the presentation to post any questions that you have, and if possible, to whom you're answering your question. And lastly, please take care of yourself. If you need to step away for any reason, please do. A recording of today's webinar will be uploaded into AMP. And without further ado, I will hand it over to Dr. Tomas Nuno.
Thank you very much, Liz, for the introduction. Dana, thank you as well for the introduction and setting up our webinars. As they mentioned, I'm Dr. Tomas Nuno. My pleasure to be here with you today. My section of the topic is going to overall look at data organization from a sort of the setting up a big picture perspective. I like the little graphic for those of us that remember using floppy disks to store our data. And there actually was older floppy disks that are even bigger than that. So I imagine maybe some of you remember even that. But it's a little graphic how times have changed, and we use jump drives and now the cloud, and curious what's going to hold for the future. But I just like that graphic. Next slide, please. So an overview of my section. 2 main areas going to cover data governance and privacy, and also going to talk about data sharing agreements. Next slide, please. So regarding data governance includes a collection of processes, policies, roles, metrics, and standards that ensures an effective and efficient use of information. It helps establish data management processes that keep your data secured, private, accurate, and usable throughout the data life cycle. So those are very important terms: data secured, private, accurate, and usable throughout the data life cycle. Next slide, please. So a robust data governance strategy is crucial for any organization that uses data to make improved decision-making and ensure successful outcomes. When collecting vast amounts of internal and external data, you'll need to have a strategy that manages risks, reduces costs, and executes organizational objectives effectively. This little graphic is a great example from an organization called Intellipat online. They had this nice graphic on data security controls. And I think many of us are familiar with these, but they're great to review in terms of how data security can be controlled and taken into account. Includes such items as data masking, authentication, access control, encryption, backups and disaster recovery, data resilience, data erasure. So all of these, I think many of us are probably familiar with authentication when we do two-step authentications to log onto our various programs, and encryption as well when we receive data from that, say, comes encrypted from government organizations, and definitely backups, backing up our data and how that data is backed up and potentially recovered. Data security has also made the news lately with in terms of data when it's breached and hacked, and how that can be very problematic in terms of organizations and the cost of extortion costs. So I think that these types of data security controls all need to be taken into account when in terms of underneath that data governance. Next slide, please. Going on a little farther from data security, let's consider the area of data privacy. Data privacy, it's an aspect of data governance. It's how data is collected, shared, and used. It refers to your personal information and is also called information privacy. I like this little Venn diagram to kind of show how privacy and security are distinct, but where they overlap. We talked about security in terms of confidentiality, data, how it's being stored is safe from unauthorized access and use, the integrity of it, that data is reliable and accurate, and availability of it, that data is available for use when it's needed. In terms of privacy, it's collection, we think of privacy in terms of collection of personal information, using and disclosing personal information in an authorized manner, data quality, and access to personal information. So the overlap is protection of this personal information, and very important from all the work that we do. Next slide, please. So in terms of that data privacy and protection of information, two main areas: personally identifiable information and personal health information, among other data types that are big concerns in data privacy. So this type of data can include your social security number, health medical records, financial data such as bank account and credit card numbers, your full name, race, national ethnic origin, age, religion, physical and email addresses, student ID number, birth date, DMV number, location data, say from your cell phone, employment history, criminal history, blood type, etc. So all of these types of information are personal identifiable information, personal health information, are examples of that type of data. Next slide, please. So access to this data, as you can imagine, is very highly regulated by governments. So common regulations you should be aware of when using this type of data in your research include all these different types of organizations. I have GDPR listed first, which stands for the General Data Protection Regulation, actually European rules. So I don't think we have anybody from Europe here, but if you are, that's one that's you definitely have to consider. CCPA stands for California Consumer Privacy Act. FERPA, the Family Educational Rights and Privacy Act, very familiar for anybody that has information at universities for their student information. And two that are probably the most common that we deal with in our health sciences research: the Common Rule and HIPAA, the Health Insurance Portability and Accountability Act. The Common Rule has mainly to do with protection of human subjects. So key things, a part of that are consent forms to be part of research, IRB approval of research projects. HIPAA, HIPAA has a privacy rule that establishes the conditions under which protected health information may be used or disclosed by covered entities for research purposes. So research is defined in the privacy rule as, quote, a systematic investigation including research development, testing, and evaluation designed to develop or contribute to generalizable knowledge. And there's the Code of Federal Regulation, the CFR, that states that. Also, a covered entity may always use or disclose for research purposes health information which has been de-identified in accordance with that rule and with those rules, without regard to provisions listed below. And I list the link so you can look at those provisions. So there's several provisions that can be without regard, as long as the data is de-identified and for research purposes. So definitely the common rule and HIPAA are two things to be aware of when we deal with this type of data for our research and our programs that we do in the public health field. Next slide, please. How that data can be shared, a lot of times we have to do data sharing agreements. So a data sharing agreement is an agreement between two or more parties that outlines which data will be shared and how the data can be used. The typical items found in a data sharing agreement are the period of time the data is to be available, the intended use, confidentiality, and security information, usage constraints, details on confidentiality requirements, and financial costs. Such an agreement serves two purposes. One, it protects the agency providing the data as well as the data subjects, ensuring that the data will not be misused. And two, it protects the intended recipient of the data by providing confirmation that they are authorized to use that data for the proposed purpose and that the data transfer is complying with legal and ethical standards. It's important to recognize that the process for setting up data use agreements varies across institutions and often depends on the type of data that is being shared. Next slide, please. So yeah, I'm just going to finish with two examples of data sharing, data use agreements. The first one is from the National Cancer Institute. They have a data use agreement for their SEER Medicare data. So this is a screenshot and I want to read a couple of key lines. First, the first couple, information pertaining to an individual's health status and medical treatment is sensitive. Therefore, specific laws, including the Privacy Act, which we mentioned, of 1974, and HIPAA of 1996 have been enacted to ensure the confidentiality of health information. So they go on to describe what's going to be used, and in bold, in order for the National Cancer Institute to provide the linked this data, it is necessary that you agree to the following provisions. So they have a list of about, I want to say 18, 20 provisions that you have to agree to, and then you sign the form at the end, and you come into agreement with the National Cancer Institute on how to use that data. So that's a federal type of an example of a data use agreement. Next slide, please. Here in Arizona, we have the Arizona Behavioral Risk Factor Surveillance System, which is the organization that runs the National Behavioral Risk Factor Surveillance System from the CDC. Publicly available data that's collected nationwide on a statewide basis. But there are data that's collected that's not publicly available from the CDC website or from the state websites. And that includes data that's, if you look at the screenshot, the fourth bullet point on the note, the bolded note, a limited data set with an executed data sharing agreement is available. To request the data sharing agreement, please contact the email. Limited data sets includes certain geographic identifiers at the county level and includes 5-digit zip codes, but exclude any primary care areas and nearest intersection data elements. So interesting that anything below the state level is considered identifiable, including the county level and 5-digit zip code. And that's why if you want access to that data, you have to come into a data sharing agreement with the state of Arizona to use that data. And next slide, please. Oh, and now that's it. And now I'd like to introduce Zoe for her options for data management. Thank you.
All right, great. Thank you, Tomas. That was really informative, and it kind of leads into what I'm going to be talking about, which are options for data management. So we'll just go ahead and get into it. All right, so in general, what is database management or data management in general? It is the process of collecting, keeping, and using information or data in an effective way. But the word effective might mean different things to each organization. So it's really important to have a good data management plan and or data management practices to report data that's both effective and also efficient. And this can depend on how important certain data is and how usability is prioritized by your team. So this type of data management is really important when working with clients. Like Tomas said, there's a lot of information out there that is protected, especially like patient health information, PHI, things like that, according to like HIPAA or FERPA, depending on what type of data you're working with and what type of people you're working with. Storing client information must be protected and safe. But it's also important that the data and information, if you're reporting the data or need to analyze or just get the data in general, is also easily accessible and also able to be understood by members of your team who are using the data. So that's a lot of things to keep in mind. But when you're working through a data management plan, there are a few things that you should kind of think about. One of them is to remain flexible. There are many things that can go wrong when you're piloting data management. Sometimes we have a really good idea in theory, but in practice, it doesn't seem to be working, especially when there are a bunch of different people reporting data or using or collecting data. Some of those things just don't happen, even though we think it's a really good idea. So making sure that you can remain flexible is really important in this scenario. So especially when you're working with other community health workers, staff, or partners, data might mean different things to each person. So you want to make sure that when you're making your plan, you're planning for flexibility as well. Also, another thing is to maximize safety, especially when there's any patient health information involved or just people in general. When working with certain referrals or even public facing parts of the project, even if you're doing like surveys or petitions or things like that, we need to make sure that people's information will not be shared outside of people either helping them directly or just using the data. It shouldn't be shared outside of those people. So when you have a data management plan, you want to make sure you're planning for protecting that data. This can include keeping information, maybe like all on one sheet, an original data set that includes people's information that's not shared outside of anywhere. And when I say shared, this can even include things like emailing that original data set with names. That's actually not a secure way to communicate data because there could be data leaks, especially in emails. We don't know who can potentially see that if a leak got out with emails. So that's not a very secure way of sending information. So that's also something that you would want to define in your plan. Also, it's important to make sure to have trainings to make everywhere aware of the best practices and your data management plan that you've created. And then also upkeeping these trainings and updates to make sure that people are utilizing the most up-to-date practices, and that keeps your data safe and effective and easily usable. So we'll go ahead with the next slide. All right, so moving forward and finding out what works, it's important to work with the team to find out what they're comfortable with in terms of platforms and technologies and things like that. This can really be different for each person. So in a lot of situations, some people might not want to use things like Google Drive because they don't have access, or they don't want to use something like Dropbox because they don't have access. There are a lot of things. Some people prefer paper, some people don't. So you want to make sure that you're working with everybody on your team to firstly create your database management plan, but also effectively communicate to other things. This can be a little bit of a challenge, but as long as you keep in mind to remain flexible, there are a lot of ways that you can effectively navigate this. And there are some common challenges that can come up when you're creating plans and working through your data management. One thing is that the data collection can become out of date. So that means that the data collection strategies and how you're getting it doesn't serve the proper purpose anymore. So for example, if you are collecting a bunch of information from people like referrals on paper, but a lot of those papers were coming in very quickly, more quickly than expected, and uploading all of this information by hand took hours and hours. Even though that was a really good idea at the time, as that organization grew their referrals, that becomes really out of date because it takes a lot more time than usual. So what you'll want to do is you want to make sure that you're keeping up to date and combating all of that out of date stuff and updating your data management plan. There's also a problem that could include like too many sources of information. So this can happen especially when we're working with a lot of different partners. So they could be giving information to you that have different variable names, or the way they categorize their referrals are different than the way you categorize referrals. So when you're working with external partners, you want to make sure that you have a conversation about which one of our variables like overlap, which one of them mean the same thing, and make sure everybody's clear about exactly what you're asking when you're trying to collect data from somebody. Also, it's really important to, when you're transferring data between partners or working with certain data, just keeping in mind the idea of security when you're transferring data between those, as Tomas said. Also, another thing could be like changes in data requirements. So that can include like reporting changing, maybe including more sections, maybe you need to be more specific in how you're collecting data. So that can happen a lot of times when we have to be really specific on our data. So it's always important to make sure that you're collecting as much information as possible without burdening anybody, like especially when you're working with clients. You don't want to ask them too many questions, but making sure that in your database management plan that you're collecting enough information so that you're not like caught playing catch up a lot later. Also, transferring data, you want to make sure that there's no PHI on there, making sure that your codes are lining up the way that you want to, and data matches between organizations. So that's a really important thing to keep in mind, as I talked about earlier. And how can we kind of overcome some of these challenges? So it's really important to make sure that you're using what works best for you and your team. So for example, you could have a data manager, someone who's really in charge of working with the data and being able to interpret the data for other people. So a lot of times data is not always super fun to look at, I know. But if you have a data manager who can just get information for you and for your reporting, that could help, having someone just designated for that. Something else could be hosting refresher trainings, especially when you're changing your database management plan. In the same thread as before, you could also partner with consultants to help you create a database management plan, or work with certain software or web-based platforms that can help you set up your database management, because you might have an idea of exactly what you want, and a consultant could have an exact idea of what you need to get there. So that's also a way that you can kind of get through that. And then also working with the TA team. So there's also a lot of ways that you can just contact the TA team, and they will help answer any questions to the best of their ability and try and work through any of these things with you. All right, next slide, please. Okay, so some example of like options of where you're storing your data and what you can include in your database management plans. One of them includes like local offline options. So one thing that is one of those is like the Microsoft Office. I think a lot of people have heard of like these type of things. So Microsoft Excel, Microsoft Word, and a lot of those type of things. You can store those offline and have them on a local drive of your organization. So that's also one way that you can just store, and only people in your organization can have that. That's a very secure way. However, if you're using like the cloud version of like the Google Suite of anything in the same ballpark, you want to be aware that if your cloud option is not protected by HIPAA or compliant in terms of like patient health information, that any data on there must be de-identified. So it can't have any of that social security, the names, the demographics, or things that could connect back to a certain person, as Tomas was talking about earlier. So that stuff can't connect back to a certain person. We can't be able to identify if you have your data that involves people on like a cloud option that's not secure. However, there are some options that are that are HIPAA compliant and are secure. I'm going to kind of go through one of them a little bit later. Some of you might have heard of this, but there's a website called REDCap. It is HIPAA compliant. A lot of different organizations use it for data collection, and you can create instruments directly on there, and you can also store the data directly on there. So that's one method that kind of does it all, but it's just a way that you can, regardless of what platform you're using, you're going to want to create a database management plan. And I'll just kind of put it into practice in a little walkthrough in a little bit. All right, next slide. All right, so our little example, I'm going to be highlighting my database management planning for a little fake data project through REDCap. It's commonly used to store large amounts of data. It's HIPAA compliant. And it is web-based, so you can use it online, but it's also protected and no other people outside of the people you share it with can get into it. You can also make multiple instruments to collect data directly from community health workers or partners, or even yourself entering data. You can enter data yourself directly in there. And it's also customizable and editable for flexibility. So I'll go ahead and do a little walkthrough on my end, if that's all right. Okay, so I have a little walkthrough right here, as you can see, in the last minutes of my section. So I've created a little database here, and in my fake scenario, I have different quarters, and I have to report on these separate quarters. However, oh my gosh, it gets a little bit tricky because I have a few different partners that are going to be reporting. So firstly, I have the epidemiologist team who's going to be reporting to me. So that includes me, Tomas, and some other person. So what we have is we have an arm, what's called an arm for us, and that separates my data from the rest of other people's data. We also have people who do like technical assistance or training. And what we have is I've separated them into another arm. So when you have different partners, you want to make sure that you're separating the data so nothing gets too confusing, and so that you know exactly where certain data is coming from, especially if they need to report on different things. And then I also have another arm for CHWs. I don't have any yet, but I've planned for flexibility and I've planned ahead. So I also made them an arm as well. So in terms of what I know about what I'm going to collect with my data. So what I need is that I need each person to receive an instrument, and I need them to be in a group. So what I've done is I've made Tomas and I've made myself into our own group. And that's how I know for sure that my data is going to be separated and very compartmentalized so that I'm able to just grab data directly from the epidemiologist team when needed. And so what happens, Tomas has now reported for Q1. So what I've also have is that there's a reporting document. So I've made something that collects the date, which is also really important, especially when your data is time sensitive or bound by certain time limits, especially quarterly reporting is very common. So I want to make sure that I know which date they're filling out the survey. And another thing is that I've thought that there might be a certain way to collect data on what trainings that Tomas has already taken. So I've actually created a question for him to upload his trainings to me, because that's the most effective for what we're working with. So I've already established this kind of precedent to collect this data in a way that's effective, both for me because I'm getting the file directly, but also for him because he doesn't have to input all of his trainings over and over again. So you want to make sure it's effective and efficient, like I said at the beginning. So there's that. And I also know that Tomas will need to report certain events that he's completed. So what I've done is I've made another survey, and there's also the date, which is important. I need the name of the event. I need to know what he did. And in my scenario, I need to know how many people he interacted with. So in this scenario, that's the data that I have. And so what he'll do is he'll fill out this form, he'll complete it, and then what he can do and what I've planned for is that he can create another event. So save and go to next instance. So that's just lingo specifically for REDCap itself, but it just kind of puts into perspective how I've thought that since there might be multiple events, I'm going to make a form, or I'm going to plan in my database plan that I'm going to allow someone to report multiple events. So it's just kind of a little bit of practice to show how you can utilize different services and how my thought process happened when I created my database plan. And just to show you the back end a little bit, I've created certain variables as well. So when you're working with certain groups or certain partners, they might have different variable names than you. So you just want to make sure that when you're creating variables across different partnerships, you know exactly what you want to be reporting on, because referrals might mean something else to a different partner. But for me, it means he either referred someone to a social service or a health service. And that's kind of in that realm. And also something you need to keep in mind as well is when you are grabbing the data from where you're storing it. So in this scenario, what I've done is I've already preemptively created reports to show me the referrals, and I can also create other reports to show me who's enrolled. I can also see how many events have been completed. So I've already planned ahead for that. So that's also something to keep in mind. And this is not the only option. It's just a little bit of a walkthrough to kind of show just a little way that we can get that going. But if there are any questions, I know that was a pretty quick walkthrough of a service, but feel free to, as Liz said, put them in the chat or the Q&A, and we can answer them when there's time. But yeah, I'll stop my share right now. We can kind of head back to the regular presentation. All right, and I will go ahead and pass it off to Luisa.
Thank you, Zoe. Hi, let me turn my video on. Hi, I'm Luisa O'Mara, and I'm from Northern Arizona University. I co-lead the evaluation team supporting the 2109 recipient, the Arizona Advisory Council on Indian Healthcare. And today my colleague Shreya and I will be talking about data management strategies based on our experience developing referral tracking tools for tribal community health representative programs in Arizona. Next slide. Okay, so I want to start out by providing just some context for our discussion. So first of all, our grant partnership, which we call CHRs with Us, is made up of 7 tribal CHR programs indicated on the map with a green triangle. And you can see in this map of Arizona the geographic spread of the CHR programs we work with. So the evaluation team where I am is located in Flagstaff, and the advisory council is based in Phoenix in the center of the state. And then the partner tribes are spread across the entire state, really. And these CHR programs represent a diversity of settings and services provided. Some programs are extremely rural with fewer resources and more internet connectivity challenges. Others are located closer to metropolitan areas. Programs are situated within different sovereign tribal nations, and they may be affiliated with either an IHS, Indian Health Service clinic or hospital, or they can be embedded in a tribally directed 638 health center. So the type of setting and facility impacts a program's autonomy, their ability to purchase or utilize, different data systems, and also the amount of IT support available to them. So I wanted to include just this snapshot of our grant cohort so you can better understand the complexity of what we were working with before we jump into describing our approach to data. Next slide, please. So existing reporting or data requirements. So for those of you who aren't familiar with community health representatives, CHRs, I also want to share these so that you have just a sense of the existing data collection that is mandated by Indian Health Services. So knowing that these systems are not modifiable, we approached this project knowing that we wanted to design something that would complement and enrich the data that's already collected without overburdening CHRs. So The paper form that you see on the right is it's called the PCC, and it's what CHRs are required to complete for every interaction with every client. So they have to code and account for every minute of their day, and then enter the data from the paper form into an electronic system you see a snapshot of on the left, which is called RPMS. And that system is really quite antiquated. It has some electronic health record capabilities, but CHRs generally only have access to enter their own visit, like client visit data, and not to enter into or see the patient's full EHR. Circled in red on the paper form is where CHRs can mark down if the patient interaction included a referral, either by the CHR to an outside service, or if the interaction was a result of a referral received from a provider or outside service. But this kind of circle and number category system is just really lacking in detail. And then the electronic system doesn't allow for tracking that referral through to closure. Of the 12 categories that are in that referral list there that they can choose from, most of them are related to a medical type provider. And only one, number 9, describes any sort of non-medical social service type program. And that area is the one that really speaks directly to social determinants of health. And that's something that the CHR programs, the CDC, Indian Health Services are all interested in learning more about as it relates to the CHR and CHW's scope of practice. So that background, knowing that we wanted to focus on referrals, we saw the opportunity to create a tracking form that would mirror in some elements of the paper form, but provide a much greater depth of information and insight into that connection between CHRs and social determinants of health. Next slide, please. Right. So around referral tracking models, this slide is exactly one that we presented to our partners last year when we offered them different levels of referral tracking that could be available. So the first level involves tracking referrals across the entire caseload by referral type, not by individual client. And this is the version that all of our partners chose to go with last summer, in large part because it presents the least amount of burden on the CHR in terms of documentation. And it's a good way to ease into referral tracking and getting the sense of where referrals are coming from and going to. The second option is what Shreya in a moment will be talking about, the sort of next level of tracking referrals by client in a digital format. And then option 3, which I won't get into, is a more comprehensive approach to referrals that focuses on sort of care coordination for high-risk clients. Next slide, please. Okay, so this is just a snapshot of the paper form, for a few pages of the paper referral tracking form that we developed with our partners and that they chose to start with. And it's been revised over time. We meet every month with our CHRs to find out how it's all going. And these forms, once they're completed on a monthly basis, they're scanned, they're submitted to our team through Qualtrics. Then we have a student worker who transfers all the data into an Excel spreadsheet. So a little clunky, but it's what works best for our partners. So that's where we are. The data contains no client information, no protected information. So it only represents aggregate information about activities and referrals, and then can be shared back to our partners. So one partner let us know right away last summer that this system, he didn't like it because he felt like he wanted referrals to be able to be tracked accurately, case by case, all the way through to closed loop, knowing that it got completed. And so this motivated us to find someone with the computer expertise to tackle this project. So once we got Shreya on board last fall, we started working through what a digital data collection system might look like for referrals, and she's going to describe that process now. I'll hand it off to Shreya.
Hi, everyone. Thank you, Louisa, for providing all of that information. Now to sort of move forward with what Louisa was talking about, I will be speaking about the key consideration that we took into account while creating the digital referral tracking system. When implementing the digital referral tracking system, several key considerations were taken into account. These include ensuring accessibility across devices and locations, providing a user-friendly interface for healthcare professionals, customization to fit specific referral workflows, seamless integration with the existing system, robust data security measures, adherence to the HIPAA compliance standards, evaluating the cost implications, and effective storage and management of the referral data. It is mostly important to note that this list of consideration was developed through extensive discussions with the manager, administrative lead, and the CHRs, piloting the digital referral tracker, ensuring that it aligns with the need and experiences so that the CHRs and the program managers find it comfortable to work with this kind of digital system. Next slide, please. So now when considering the digital referral tracking options for the CHRs, we explored various possibilities. We decided not to use REDCap due to specific reasons aligned with our goals. Our primary considerations included accommodating the technology literacy levels of the CHRs and taking into account feedback from the CHR partners who expressed hesitancy in taking on new technology challenges. We believe that it is crucial to select a type of solution that adapts and aligns well with the capabilities and comfort levels of this CHRs to ensure that a smooth adoption and there is a seamless integration into their existing workflows. So when evaluating the best fit options for our digital referral tracking for the CHR program, we considered several solutions. The first option here is the Google Sheets, which offers cost effectiveness, cloud-based accessibility from devices, and basic tracking feature. However, it has limited data management capabilities. Another option was the MS Excel, which provides powerful data manipulation features and customizable templates. However, it lacks advanced database capabilities, and offline access may limit real-time collaboration between the CHRs and the program managers. Lastly, MS Access offers robust database management capabilities, ideal for complex referral tracking needs. It allows customization of forms and reports, but it has like a little bit of a higher learning curve and requires Microsoft Access knowledge for proper usage. We carefully assessed each of the options based for the specific needs and constraints of the CHR program to best fit their referral tracking requirement. Next slide, please. So here in the picture here, you can see the MS Access database snapshot. So on the left side here on the main menu pop-up box, you have like two options, whether to add the record or show the records. When we click on add record, we see the referral form on the right-hand side. So over here, we have again 4 more options, whether to add a new entry or go back to the previous entry which we've made, or clear the contents of the form or close this dialog box. So when we click on the new entry box, we can enter the date that the referral was made to the particular client, the program ID wherein the CHR is from, the CHR ID associated with that particular CHR, and the category of referral made to that particular client. And we can also get to check if the referral was completed or it was still incomplete, and if any other notes that this CHR wants to make about their patient can be added there. Next slide, please. Yeah, so when we click on show records in the main menu pop-up box, we see the referral table, which has the all of the CHRs in that particular program and all of the entries which they have made. So this referral table can be exported in form of an Excel sheet or a PDF or an XML format. So it can be adapted to other data types as well. Next slide, please. In comparing Google Sheets and Excel for digital referral tracking, we considered various factors. Google Sheet offers online accessibility from anywhere, real-time collaboration, and cloud storage with automatic backups. However, Excel provides advanced automation through VBA programming. It also has a very similar interface like the Google Sheets, and it has the local storage benefit of the program ownership and control. We took into account the technology literacy levels of the CHRs and the feedback from the CHR partners who expressed hesitation towards the new technology challenges. Choosing Excel empowers program managers with moderate computer skills to manage the system independently without having to rely on a university-based evaluation team. Additionally, in order to ensure true data security in Google Sheets, the program would have to need to sign a contract with Google. This was one of the factors that led us to develop the non-cloud Excel version of the Google Sheet. Next slide, please. So the advantages of Google Sheets are that it is HIPAA compliant, provided that the program can sign a contract with Google, allowing for secure handling of the patient data. The real-time collaboration feature enables seamless teamwork and communication with accessibility from any device, such as your laptops, tablets, your phones. Healthcare professionals can easily access and update referral information on the go. It is a very user-friendly database system. So it has a very powerful formula library that makes data input and analysis effortless. Additionally, automation features and integration enhances the productivity and efficiency. Overall, Google Sheets provides a secure, collaborative, and user-friendly solution for effective referral tracking. Next slide, please. So here in the picture, we can see what an individual CHR Google Sheet looks like. This same identical CHR sheets will be present for each and every CHR in the program. So over here, the way it is coded is that the moment the CHR enters their client ID, the CHR ID and the CHR email gets auto-populated, and the date of referral will be pointing towards the current date when the client ID was entered, and the reminder date will be set for 5 days from the date of referral. So the CHR will also have an option to pick the PCC category. It will be in the form of a drop down. Additionally, if the result of the referral form is not entered within 5 days from the date of referral, email will go back to the CHR's email asking them to fill up that part of the form. So another advantage of this Google Sheet is that we can generate graphs and statistics for each CHR as well as for the entire program. Next slide, please. So this is a snapshot of how the reminder email will look in the CHR's email. So basically, we'll get a brief email saying that you had made a referral on so and so date, and for the client ID this one, and please go and make an update on your Excel sheet. Next slide, please. The similar similar capabilities are there even for the offline non-cloud MS Excel version as well. So the only difference is like the real-time collaboration. So in case of Google Sheets, it's easily accessible for program managers and administrators to access the others' data. But in case of the local Excel version, they will have to share the files manually. So lastly, I'll be talking about GitHub. GitHub is a powerful platform that enables collaboration and customization through open source development. It offers a central repository for storing and managing code, allowing developers to work on software projects together. With public visibility, projects can be shared and accessed by a wider community, fostering collaboration and knowledge sharing. So it also provides features for documentation and README files, facilitating clear communication and project understanding. So to access the project for the cloud and then non-cloud version, you can go ahead and click on that link, and you can access the entire project there with the tutorial about how to run the code and how you can make use of it in your own program. Next slide, please. So if you have any additional questions or you want to reach out to us, you have Louisa's as well as my email ID. So yeah, you can please feel free to reach out to either of us. Next slide, please. So before we move on to the Q&A that session, I would like to ask for a poll survey which we have created. So if you guys can take a minute and do the survey, it would be really helpful. I'll be presenting the questions now. You can let me know once the screen is visible to everyone.
It's visible.
Yeah, great. So you can just either scan the QR code on your phone, or you can just click on slido.com and enter the code, and then you'll be able to do the polling. Yeah.
Thank you for sharing this, Shreya. As you can all see, it looks like about 3/4 of people, oh, look, it just went down a bit. Oh, it's changing, are for them say that the cloud-based, that web-based type of system would be preferable for the types of programs they work with. But look at that, nearly 40% say that a system housed on a local server would be preferable, which is also, as Shreya described, what we found with the first partner we started to pilot this system with was they really preferred that safety and comfort of knowing it was on their local server and not in any kind of cloud-based setting.
I think we'll move on to the next question now. Similarly, if you guys can just scan the QR code or just enter the code in slido.com, we can move ahead and see it here. Yeah.
Thank you all for sharing your thoughts around this. Feel free to keep entering. I just want to point out that course, security makes sense that it comes up as the biggest concern, since oftentimes this type of system might be handling protected health information or private client information. But there's a lot of other things too, like it being user friendly, which is what we found in our talking with our partners, was that was really important to them. Reliability is on here many times. Yeah, being able to follow up on referrals, taking into account resources needed, being flexible, simple and easy to access, all really important.
Yeah, we can give you guys another minute, and then we can move on to, like, if you guys have any questions for us, you can go ahead and ask us that. Yeah. Thank you everyone for adding in your input for these questions. It really shows us what the demographics say, and then like what are your views on these systems. So it was a really informative feedback. So thank you everyone for providing that. I'm going to stop my screen sharing now.
All right, thank you, Shreya and Louisa, for that activity. And thank you everyone who participated. We have a moment now for some Q&A. I don't see anything in the Q&A itself, but I did see something come up in the chat, and that was for Zoe. And they were wondering, relating to your REDCap walkthrough, Zoe, if you could show an example of a report.
Yeah, sure. I can
All right.
totally do that. I'll go ahead and get my screen back up.
Of course. And
Awesome.
if anyone else has any other questions, please put them in the chat.
Yes, so thank you for your inquiry. So when we're making like reports and stuff like that, something about like web-based platforms is sometimes they can make the reports pretty user-friendly and sometimes they can't. I feel like in this case, it's not too bad. So what we have right here is we have a couple reports. So I'll go ahead and open this one up, which is like just our enrolled partners. So as you can see, we have our people who have reported. So that Liz has reported, I reported a little bit, and Tomas has reported. So in this case, like this is a very raw report. So it has like these things that kind of seem a little bit difficult to understand, like what's a repeat instrument and what's a repeat instance. In that case, that's something that it's kind of similar and related to what Louisa and Shreya talked about, how this type of data isn't always usable for everybody, especially if you have not been trained in this type of platform. And that's why they went with something that was more user-friendly. But in this case, what we can see is the variables that I created in my data management plan, including like the name of the person, their role, their organization, and if they've completed their survey, as in like, is their data complete? So you can see in one of the epidemiologists, they haven't like completed theirs, so they'll probably come back to that. So that's just an example. And what you can do from this type of website is you can export the data in a way that's might be more usable. So you can export it to like an Excel sheet, or if you have analysts on your team, you can also export it in like a statistical software format. So that's just one way that you can kind of do this type of reporting. And you can, on REDCap specifically, you can kind of edit what we're doing with the report. So I could take out certain variables, or I could add certain variables from other places. So that's just something that you can kind of customize when you're using something like this. So not all software or web-based or cloud-based platforms will look like this, but that's just an example of this one. It just kind of takes some messing around to kind of get right. So there's that. Thanks. I hope that was an okay example. It just takes a little bit of time to kind of mess around with.
Thank you, Zoe. Yeah, if Miss Irene, if you have any follow-up questions, you can put them in the chat. I don't see any other questions in the chat right now, so I have some prepared for our presenters. The first one is for Tomas. Do you happen to know where projects could look for some examples or ideas to inform and improve their policies and practices around like data security and practices?
Thank you, Liz. So it was about improving practices in terms of data security.
Yeah, data security and privacy, or just general like data governance, like policies, if someone wanted to improve their own programs policies around that.
Yeah, I think definitely in terms of data security, IT resources, and if you're definitely the IT departments, if you're at our county, IT state, federal, those are a business that's probably be the best bets for data governance and data security. Here at the university, we have our IT department, which really regulates all of our data safety at the university. Just been online searches. There's lots of good resources out there from the federal websites talk about data issues in terms of the different agencies. So I think that's good information. And NIH, CDC have their policies on how they do their data governance. CDC in particular has lots of publicly available data, so that the data that's downloadable, publicly available. So they discuss there too, if you do a search on the CDC website on how their data is shared and how they collect their data. Those are the big ones. I think we do have to be careful with our just Google searching and finding any websites that pop up. But in general, I think federal agencies, state agencies can be trusted, and universities and our IT departments. I think that's one of the best bets for secure data security. In terms of privacy, the common rule, and if you do Google search common rule and HIPAA, I would say federal websites. In fact, I can put in the link here. Let me see if I have it open right now. Yeah, so here's HIPAA. Go to the HIPAA home. Yeah, so you got the HIPAA homepage from the U.S. Department of Health and Human Services, and you can click on the icons for HIPAA for individuals, HIPAA for professionals, filing a complaint, and newsroom. So let me put that in the chat here. Let's see if I can share that there. And I want to share it with everyone. Okay. So yeah, so this is the federal website on Health and Human Services on HIPAA. And I think that can give lots of detail, much more detailed information that I provided on my 2 slides of HIPAA. But I kind of gave like the condensed big highlights of what HIPAA means. But very important, deals with all the data in terms of privacy and the data privacy and the security, making sure it's secure. Does that answer the question, Liz, or any follow-ups?
Yeah, we do have a follow-up question. So since cybersecurity is being mandated by government contracts, there are many companies out there, and she wanted to know if anyone uses Microsoft cyber programs. And that might be a question more for Shreya and Louisa. I know your team, looked into Microsoft programs. Do you have any feedback?
Yeah. So like I previously said, in order to like if you're using any Microsoft or Google online cloud-based systems, you will have to sign a contract with Google in order for it to be HIPAA compliant. So that is one way you can ensure that your data is secure and it adheres to the HIPAA compliance.
Yeah, and of course, if anyone else uses any other Microsoft programs and you can speak to that, feel free to post it in the chat and connect with Miss Irene. Did you have something to add, Louisa?
Not really. I don't know the answer to this. I was wondering if maybe Tomas, since it speaks to cybersecurity when government contracts, if you had familiarity with anything you've been on that required something specific beyond just
Yeah, most being part of the university, just following university policies with, in terms of the use of the HIPAA compliance systems here, REDCap, mainly what I use for projects that I have. I know, like that, I shared that SEER Medicare data use agreement. So they have a whole list of, besides things like REDCap, you have to have a encryption. I mean, if that data has to be viewable on computers that have an encryption system. So different agencies will have more requirements on. And I showed that slide with the list of another one of those lists was about putting that data on portable drives, and that not allowed to do that, and things like that. Encryption. When you produce the data, if the cells are less than, I want to say it's 20 or 10, you can't put the exact number. You have to put less than 20, less than 10 to maintain confidentiality. Yeah, no, I that was my answer. Is that my key one is that in terms of data security, following the university's IT procedures is what I try to do. But it's a big issue. I mean, right now I just Google because I'd seen it in the news, and yeah, there's looks like it's something called HCA Healthcare. Says data breach appears to be a theft. So it's the health system. It says the patient data, which is posted online, includes names, phone numbers, and appointment information, but not clinical or payment info. So I guess that's good. Huh? They didn't post that information, but very, very, very scary because I guess they give them ransoms to pay, and if they don't pay it, they can put this information that's very private in terms of. So I think that's an example of an organization that had a breach. So it's something we all need to be careful of. And there again, I defer to the IT experts wherever we work. And I don't know if you're in a small organization. I'm not sure if that's or something that could be contracted or worked with to try to get that or some kind of contracting can be done with IT specialists.
Thank you all for weighing in on that. And of course, Ms. Irene, let us know in the Q&A or the chat if that answered your question. You said thank you. So I hope that was helpful. But I will share my information at the end. So feel free to reach out if you have follow-up questions. With the few minutes we have, I did have another question. This one was for Zoe. There was some interest in REDCap. So I was wondering if you could tell us a little bit about like what the learning curve is for REDCap, and like what kind of training might be involved if a project wanted to start using that software.
Yeah, for sure. So something like a cloud-based platform where you're kind of building forms yourself and you have to kind of come up with variables and think about how you're going to pair variables together and stuff like that. That kind of back end work is quite extensive, and it might be best to, well, the good thing about REDCap is that there are a lot of like trainings on the website or on YouTube. Like a lot of people have already created a lot of self-learning trainings for something like REDCap programming. So that will take a little bit more of learning curve than say someone coming on just to report the data. If you're someone who's just coming on to get and report data, that learning curve is a lot less difficult because if you had a database manager or the creator of your REDCap project, teach everybody and train everyone what to click on and which variables mean what thing. That's typically like a one and done type of training with certain refreshers. So that type of training is not too extensive, but I would say the heavy lifting is definitely if someone on your team were to kind of be the creator and the designer of the projects, just because of how extensive the instruments might need to be separated or how the variables are named, and making sure that all data is agreeing with itself and each other and all these other partners. So I would say the heavy lifting's on the designing side. On the actual usability side, that one's more of that one can be a lot more internal, but any external training and kind of seeking out of things is definitely on the back end, as opposed to the person who's just filling out the data. So I used to be on a team with community health workers. So I was the creator. So I sought out a lot more trainings on how to create certain instruments and what we could do. And then I would hold trainings for the community health workers on how to kind of enter their data, and they would give me feedback on whether the variables didn't make sense or if we could have done it an easier way. And then I would edit it on the back end. So it was a lot of collaboration, which I definitely think helps with the learning curve a lot.
Thank you, Zoe. And since I don't see any other questions right now, I will bring us back to the PowerPoint and wrap us up for today. Okay, so I want to give a special thank you to ASU's Office of Community Health Engagement and Resiliency, which was directed by Dr. Mary Ellen Brown, as well as all CDC, CCR staff and partners for their support and assistance with promotions and marketing. And of course, each of our speakers and staff members who assisted in making today's webinar possible. So here is an upcoming webinar happening on July 27th. Envision will be hosting this webinar where they will go over navigating their Envision Equity platform. And I will put this link in the chat for you for anyone interested in registering. And we have information about a pre-recorded webinar that was put together by our partners, WASEP. This is about it's an on-demand webinar that provides an introduction to the participatory evaluation graphic that's used in the evaluation community of practice groups, which some of you might be familiar with if you participated in an evaluation community of practice already. And so there's the AMP link to that pre-recorded webinar. And lastly, I just wanted to say that this presentation was supported by the cooperative agreement funded by the CDC. Its contents are solely the responsibility of the presenters and do not necessarily represent the official views of the CDC. And you're going to see a short survey pop up on your screen. Please take a moment to answer the assessment questions to let us know how you enjoyed today's webinar. And at the bottom, you'll find my contact information. Feel free to reach out to me if you have any questions about today's webinar, or if you'd like me to put you in contact with any of our amazing presenters today.